Welcome, everyone, to this episode of Shirley Talk. I'm Mike Mulroney.
I'm Kelly Duckworth.
Miss Kelly, are you a doctor?
No.
Nurse?
Nope.
Psychologist?
Nope.
Anything to do with the medical field?
Nothing.
All right, we do that every time because I'm not either. I wasn't smart enough to be a doctor. So we just do that because this is for educational and I hate to say entertainment purposes only, but if you hear us say something today on our podcast, please check with your medical provider, your accountant, your attorney, anybody with a legal status other than ours, okay? So how about that? But today we do have a nurse. Are you you're in survivorship, so it says RNCN, certified RN. I see that on your tag. Yeah,
yes.
We have Miss Deanna from Brown Cancer Center, U of L Hospital.
Hello.
Hello, how are you today?
I'm great today. How are you?
Wonderful. Well,
Great.
thanks for coming in. We've had several of your coworkers come in previously, and they often mention survivorship. So we were super excited when you agreed to come in here and talk about this today.
Well, thank you. I'm super excited to be here today.
So what's that mean, survivorship? Is that something new, like, it's in the past 10 years, or has that always been a thing?
So survivorship is relatively new. Maybe it goes back about 20 years.
Okay.
The American Cancer Society says that by 2026, we'll have about 20 million cancer survivors here in the U.S. So basically, it's like, what are we going to do with these survivors? How do we help their issues? They beat cancer, but what are they going through now, and how can we help them?
Why is that a thing? I mean, you beat cancer, you just go on about your life, or do they have some sort of trauma related to the cancer? I know the answer to that. I'm just being a devil's advocate on the question there.
So yes, definitely. So, many patients are overwhelmed, when they're first given their diagnosis. They're given a treatment plan, of course, after everything, all their scans and tests and labs, and they're given a treatment plan. They're going through the treatment plan, and the day comes, they're finished with treatment. The doctor runs the final scans, and they're like, hey, your scans show no evidence of disease. So in other words, cancer free. And they're like, okay, what do I do now? By this time, their work life, their family life, everything about their life has changed, their physical appearance. And it's very difficult for patients to navigate through their new normal.
Yeah,
we call it.
Yeah, I don't know that anyone realizes when somebody is diagnosed with cancer, everything that comes at them. Again, we've been talking to your other coworkers, and they talk about how many people show up in the room to talk about the different treatment plans and different things that they're going to go through. It's basically organized chaos, I guess you could say.
Absolutely.
Because they'll have 10, 15 people walk in. I'm this person, I'm this person, I'm this person. I do this, I do this. So where does survivorship fall in?
So in light of that, all the people, all the hubbub, all the organized chaos, I kind of hang tight. I step back, and even though they don't know I'm there, but
You're listening.
Yes,
Okay.
I'm listening, and I'm hearing what's going on. And when they're getting towards the end of treatment or finished with treatment, then it's my turn to step in.
Right.
And by this time, they're more familiar with their care providers, and some of the hubbub is quieted down a little bit. The dust has settled a little bit. So I step in and introduce myself, and I tell them I'm Deanna. I'm the survivorship navigator. Or nurse, usually I say, because they're like, you're what? So I introduce myself, and one thing I do for our patients is I write what's called survivorship care plans. And the patient will actually get in their hand a treatment summary. And it's in lay language pretty much for anyone to read and understand. And it basically summarizes their whole treatment. The day they were diagnosed, what their diagnosis was, and I do put the specific cancer they had, and not just lung cancer, because everybody knows they have lung cancer, but they may actually want to know the exact pathology. So, I might say small cell cancer or adenocarcinoma or whatever the case may be, in the stage as well. Just so they'll have that information. And then, okay, what happened next? So you had surgery, and then I'll put their surgery date, who did the surgery, what was the name of the surgery, and then, okay, now you had chemotherapy. So what was the name of your chemo that you had? And I'll list all the specific medications and how many cycles in the days, and it's very specific, and radiation as well if they had that. And that's just for them to keep. And a lot of times as they're going through all this, they're not really processing that. And I review this with them and talk about it with them. And they're like, oh, so that's what that was called, or that's what that was, or, I never even knew what stage I was. So it's almost like a recap, a way of processing.
I envision this like a cheerleading session. So like
It is.
you're going through each step that they beat and really convince them not really convincing them, really explain to them that they beat the odds.
Absolutely.
Is that kind of how the discussion starts out? Or, I mean, because when somebody is fighting something like this, they're down. They've
Right.
been beat up. Their
Right.
body's been through all kinds of stuff. So I could see this kind of turning into a cheerleading session about, look what you just did.
It is, but before I pull the summary out, when I make first contact with them, I just ask them, it's like, how are you doing?
Because everybody's different,
Yes,
I assume.
it's like, what's going on with you? Are you eating okay? Are you sleeping okay? Are you doing activities that you want to do? Is anything keeping you back from, the activity you like to do, taking your kids to the park or driving them to school, or, whatever it is you're doing today.
Right.
So basically it's just a pretty general question on how they're doing. And then depending on how they respond and what's going on, I just kind of let the patient be the lead, and I just basically listen.
Yeah. I mean, we've talked about this before with people that have fought cancer and won. They've got some PTSD going on. Some of them have been through the ringer on treatments and surgeries and stuff like that. And they kind of have to sit there and get their head and shake their head a minute and get their wits back to them. So, but everybody's different, obviously. So, I mean, do you have a percentage of people that respond to you in a pretty good way, or are they looking at you like, I just want to go home, or?
So usually when I first make initial contact with patients, it's at a follow-up medical oncology appointment when they've pretty much completed treatment. Now, some patients will be on what's called a maintenance.
Right. Maintenance drug.
Yeah. So, and in that case, that can last up for a year or more. So I come in pretty early in their maintenance drug phase. But for other patients who have completed, that's usually when I make first contact with them and introduce myself, and I tell them about the services we have to offer. But normally first I just ask them how they are, and then I go from there. A couple weeks ago in survivorship clinic, I had a patient tell me, I just cannot wrap my head around that I had breast cancer.
Most people are in shock.
Yes, and she was still in shock. And, and in that case, we do have a behavioral oncology, which is a therapist that's a specialist in that area. And she's under our roof, and it's no charge for patients. We send patients there if they're having, any kind of issue like that. Even if it's not related to their cancer totally. It probably is indirectly in some way, but yeah, so we have a therapist that can help process that and go through those things with them.
So I'm sure this changes every week, but I don't feel like we hear about a lot of survivors, so are you busy every week? I mean, do you I'm trying to think. I mean, I know that there's constantly people getting treatment, but how many do you really see that are done and get to come see you?
So I can give you some numbers from 2020, and we are in 2021. And it's funny, I do get my years backwards because of this pandemic we've been in.
Yeah.
I'm really losing track of time.
You say last year, but we didn't do much last year. Well, you did, but the country didn't do much last year.
Right. Well, I did. Yeah. So for 2020, I actually delivered and discussed survivorship care plans with 398 patients.
Holy cow.
And that's something that I do face to face. For the pandemic, I did do some over the phone, which I prefer not to. That's very last resort. But face-to-face is the way to go, because you can really, get to know a patient better that way. And, it's better face-to-face.
We've always said that about diagnosis too. People that get diagnosed over the phone, and we're like, that's not something you discuss over the phone.
Yeah, that's a difficult one.
Yeah.
So usually at a medical oncology or radiation oncology follow-up appointment after they've completed treatment, I'll just, in between all the doctors and everybody and the nurse practitioners and everybody seeing this patient, I'll be like, it's my turn now. Mm-hmm. And I'll go in and just introduce myself and start the conversation from there. How you doing? What's been going on?
So after you hand them the sheet to show all their treatments that they went through, what's it look like after that? Is it like a rehab type thing where you meet with them once a week, once a month, and follow up with them and kind of steer them in the right direction? Because I'm thinking survivorship is mostly mental, but maybe it's not. I don't know. I don't know enough about it.
Yeah, it's both. It's physical and mental.
So do you kind of guide them through their physical therapy as well, since they've...
So it depends.
Okay, yeah.
The reaction, the physical problems is as different an individual as each person is,
right?
Obviously, but so I just get a good feel, how they're doing. We talk about wherever the patient leads. No, I'm still not able, to get my appetite back. I haven't gained my weight back. That sort of thing. But I really encourage patients to come to Survivorship Clinic.
Okay.
So we actually have a clinic that is staffed by Dr. Megan Nelson, which she's been on your show prior.
Yep.
And I work very close with Dr. Nelson, and she is a rehab physician. So she will assess the patient. I schedule them just like they see any other doctor. They come in, they register, the medical assistant puts them back in a room, gets their vital signs, and Dr. Nelson assesses them and, checks, their functioning and how they're doing. And she may prescribe a physical therapy regimen, or she may prescribe acupuncture, or depending on what the problem is, or she may, prescribe medication, or she may just, prescribe lymphedema clinic if that's the problem the patient's having. So it's pretty much kind of a jack of all trades thing. It's whatever issue the patient's having is what we address.
Okay.
Is this patients only, or do you help caregivers and family members too if they're having some issues?
Yeah, so we do have a lot of services that our family members can share in. Like massage therapy, music therapy, and they're all free of charge. I think our therapist will see a family member with the patient. So we like to get family members involved in, too.
So do you deal a lot with, you hear about survivor's guilt and people that have beat cancer and just really struggle because the person in the room next to them may not have made it? I mean, is that part of survivorship as well?
Yes, it is.
Okay.
Yeah. There's just so many sad stories and bad things that we've heard, that have happened to people with cancer, and they lived, they survived it. Their scans are clear, and they're like, wow, why did I survive? What makes me so special?
How long of a program is that for somebody? Is this survivorship? Is there an end date for somebody, or is it?
So no. So there are several many definitions of survivorship. We'll say if you go look up the definition, but at Brown Cancer Center, the day of diagnosis, you're considered a survivor.
Really?
Yes.
Okay.
So the day that's called like acute survivorship. What's happening right now. And then, that goes to extended survivorship, which is about, at the end of treatment for maybe a year or less. And then, of course, permanent survivorship is usually measured in years. But there's also metastatic survivorship. There are patients out there who, due to all the advances in medicine and treatments, that they're able to live with cancer almost like a chronic illness, like people live with diabetes or COPD in their lungs or things like that. So that's a metastatic survivorship.
I didn't even think about that.
Yes, and those patients can live for years on immunotherapy and different medications that's keeping the cancer like stable, just keeping it where it is, keeping it from growing. People can live like that for years. So this year in 2021, we actually extended our survivorship clinic to metastatic patients, to include them as well.
Okay. So do you deal? So you're basically when the treatments are over. So metastatic, is that something? Basically, they're not going to beat it long term. They just are going to have several more good years. Hopefully, is that
Yes.
so? You all are probably working with them on a regular basis, because I can't imagine having that in my head the whole time thinking about it. It's got to be a mental drain on somebody to know that they're still suffering with that.
Yes, and many patients are just they're happy to get when they get to the phase of acceptance. They're happy to get any extra time they can get. Maybe they want to make it to see their daughter getting married or their first grandchild or whatever event in life. But a lot of people are just very happy and to be able to get any minute they can.
Yeah. You said acceptance. Do you all help them try to get to that point? Is there a point where you can see the light in somebody's eyes where they understand what's going on and they're just accepting of the extra days they have, I guess?
Yeah.
Is that part of survivorship? You all kind of help them get to that? Or?
It is. Well, so
I imagine you have a staff of psychologists or something.
So we do have, like I said, we do have oncology, behavioral oncology department that has a therapist, and she works with them.
Okay.
And if she feels like, it just depends on the session with the patient, how that goes, and if she feels like they, need more like long-term help, she'll refer them to where they need to go. So as far as me, I do not do like therapy or anything like that with the patient, but what I do is help refer the patient to where they need to go. That's kind of why I kind of fill out how they're doing, and another thing that I think is very important to our patients, I tell them, all my patients have my phone number. Call me. If anything comes up, you have a question, you don't know who to call me. A lot of patients going through treatment in some cases every day, see their radiation nurse every day or see their infusion nurse every day, and then treatment's over and it's like, oh, now I don't see that nurse anymore. I don't have anyone on a day-to-day basis who I can ask a question. So, and that's kind of where I step in, and that's what I tell them. It's like, it's like you may have not see this nurse every day, but now I'm here, and if you need to talk, give me a call. So they all have my number.
Your cell phone number?
Yeah, my work phone number. Yeah,
Yeah, that's incredible because you don't see that very often. That's pretty amazing.
It's my work number.
Yeah.
It's on all the survivorship clinic literature, so it's all there. I get all those calls.
Yeah.
So it's there. They can get a hold of me.
So how did you get to this point in your career? I'm sure you went to college just to be a nurse and then decided oncology, and then you don't go to college for survivorship. I feel like.
No. And if you mentioned that to a lot of nurses would be like, what? What is survivorship?
Right.
Nursing. So survivorship goes, well, I became a nurse back in 1994. I graduated from U of L nursing school. And then my background is cardiac. And I worked in cardiac for maybe a little less than 20 years. And then just got interested in oncology, and then made a gradual switch. The more I learned about oncology and all the latest, medications and chemo and immunotherapy that are being developed, it just really fascinated me. And I worked at an oncology center here in Louisville, and there's an agency that gives accreditation to cancer programs, and it's called the Commission on Cancer. And one of the requirements to be accredited is to have a survivorship program. And this was way back probably in 2014, 15. And my manager was like, hey, we need to do this, for accreditation. And would you like to do this? And I'm like, no, I'm good where I am. And, she kept pounding. I think you'd be really good at it. I'm like, okay. So I finally gave in and read the requirements and was like, okay, I can do this. Back then, the Commission on Cancer required survivorship care plans with certain data elements included. And I just started from there, started writing these up and meeting with patients. And it just kind of blossomed after that. Now the requirements are a little different now. We've got more artistic freedom to kind of form our program and focus on things that are important to us, as an organization. So we do have a little bit more artistic freedom.
When you say artistic freedom, earlier you mentioned music and art therapy. Is that part of survivorship as well, or can it be?
It can be, yes.
Because music is powerful.
Absolutely.
Yeah.
So, yes. So, I know Dr. Nelson talked about, and Laura Jones talked about our SOAR On program.
Yep.
And a lot of it intermingles very tightly. A lot of the resources and therapies that we use in survivorship is also included. It includes the things that the SOAR program offers. So yes, it's very tightly woven, and we definitely use those.
And that's incredible. Well, anything else about survivorship that you want to bring up today? I mean, I've heard of it, but I just really didn't know what it entailed.
Right. So I'll be a little bit more specific. So we have a survivorship clinic, and a lot of patients think that it's something that's done like in a group setting or as a therapy in a group setting. And it's
that's kind of what I was thinking.
Right. A lot of patients think that. And it's like, no, is you have a one-time consultation by our rehab physician and follow-ups as needed. So if you have an issue that she has an intervention for, a prescription or physical therapy, lymphedema clinic, then she'll follow up with the patient and see how they're doing and how the current therapy is going and do they need to change, anything. So, it's a one-time consultation with our rehab physician that does a very thorough assessment of, a lot of things, a lot of, mastectomy patients can't use their upper arms very well. They use that strength and conditioning, and they lose the range of motion from those muscles and the tightening of the tissue from radiation. So she helps to get us most function back in that area, that can be, gotten back.
Yeah.
And that's basically how it works. And I'm there. I mean, it depends. Sometimes I give the patient their survivorship treatment summary earlier, or sometimes it's at that visit. It just kind of depends on where the patient is and how things are going.
You said that anybody that comes to the Brown the day one of diagnosis, they're considered a survivor. Do you all ever get involved with the people that there's not much more treatments that they can do to beat the disease, or do you all deal with those patients at all?
It just kind of depends.
I'm sure they need some guidance and stability.
Yes. And sometimes, palliative care may be the answer.
Right.
So it just depends on the patient.
Yeah.
Mm-hmm. So would you say your patients, is it 50-50? Like you give them their packet and they just go about the rest of their life and you never see them again, and then you have the other half that constantly come back for clinic and things like that? So
after a patient finishes active treatment, they'll be in what's called surveillance. So they're still coming back, depending on what diagnosis, say every 3 months.
Okay.
And sometimes, more frequent, every 2 months, 6 to 8 weeks. They'll be coming back, and they'll be seeing their oncologist still, and they're under active surveillance up until about 5 years or so, depending on the diagnosis. So yes, so patients still come and use our services, that are included in the SOAR program, and they'll call me, I had a question about, this or that, or now I'm getting some swelling in my arm that I didn't have before, or things like that. Yeah.
So you're the kind of the last stop of someone's cancer journey once they've been considered Ned, I guess.
Yes.
Okay.
Yeah, pretty much. I'm that last nurse, contact. And, and I've had some people, like, I'll introduce myself and, I'm the survivorship navigator. A lot of times I try to say nurse because, like I said, they'll be like, you're who? And I had a patient tell me a month ago, she's like, but I already have a navigator. And I'm like, yeah, I know, this person is your navigator when you first came on, but now that you've completed, I'm your survivorship navigator. I work really, really closely with her, and that is true. We're all there together. Probably before I even meet the person, I've asked, the breast navigator, how is so-and-so doing? Is it a good time to talk to her right now?
Right.
And so we do a lot of collaboration before they even see me. I'm kind of in the background for a long time.
Is it just you, or is there more of you at the Brown? Is there a team?
As far as survivorship nurse,
right.
I am the only survivorship navigator.
Are you really?
Yes.
Wow.
So I'm very busy.
I figured it was a team of people that met once a week, and
No, but
so if you're sitting on the beach, you get a phone call. Do you take it?
Sure, I do. Yeah, so I'm the only survivorship navigator.
No pressure.
But I do
Wow.
I do have a director. Her
Okay.
name's Whitney Pittman. She is a nurse practitioner. She is there for guidance, for another set of eyes, to say, hey, how's this program going? How can we improve it? She does studies, questionnaires for our patients who have gone through, survivorship clinic to see, what their takeaway from survivorship clinic is, so that we can tweak it for the needs of our patients.
Right.
And you see all types of cancer, right? You're not
Yes.
specific to one.
Yes, I'm not disease specific, whereas our other navigators are disease specific. I am not. It's all kinds.
Gotcha.
So you're famous. You're the one and only survivorship nurse at Brown Cancer Center.
I don't know about that, but like I said, most people say who, or what? No. Over time, the staff and providers and everyone is, they're getting used to it now, because survivorship it's still a new area in nursing. So we're still developing it and tweaking it every day. You know.
Well, that's incredible. Thanks so much for coming in today.
Well, thank you.
We appreciate it. And again, we're trying to educate the world on cancer and different things they look forward to. I don't say look forward to, that they're going to have to go through. And but we just appreciate you coming in today.
Oh, well, thank you for having me.
Kelly, what's the routine? How can people
The
help
routine.
Shirley's Way?
You can start by going to our website, shirleysway.org.
We got a new URL too.
Yeah, shirleytalkpodcast.org.
That's right.
He buys every URL out there. But shirleysway.org, to close out 2021, we're still pushing really hard for $1,010 monthly donors. Check out our raffles. We have 3 of them a week. Split the Pot online, queenofheartslive.org, jokerswildlive.org, and wheelofcashlive.org. So lots of ways to win some money and help out Shirley's Way at the same time.
Get out there, make some donations, and check out the show notes for this particular podcast to learn more about survivorship. We'll post some info on so you can go take a look at it and pass it along. We'll talk to you next time.
See ya.
Okay, so that was fun.